So this is a diagram of some of the kinds of deformities that can occur in the frontal plane in the hip. We see on the left-hand side a deviation of the femoral neck, which is called Coxa vara, and we see on the right-hand side a deviation of the femoral neck, which is called Coxa valga. So the approximate normal angle of inclination of the femur, which is really the neck related to the shaft, is about 125 degrees. And then the hip abductor force or moment or force relative, and its moment arm is shown here. So in these diagrams, what we're going to show is how the abnormalities of the neck change the mechanical effect of the hip abductor muscles, specifically related to the moment arm and force length changes. So in terms of positive, meaning there's increased mechanical output, essentially the moment arm is larger in coxa vara where the angle is less. So the acuity of the angle of inclination is less, in this case 90 degrees. And then also in terms of alignment of the hip joint, it improves some. And so those are the positive. The negative is there's increased bending moment arms on the neck and a decreased functional length of the hip abductor muscles. So the muscles are shortened because the neck is basically at this 90-degree angle. And then in contrast, if we look at coxa valga, where the angle of inclination is increased, we can see is that the positive is that there's a decreased bending moment arm on the neck of the femur, and there's increased functional length of the hip abductor muscles, so their length may be improved. Which is interesting that they put it this way in the chart, because if it's too, I guess they're tapping into the idea that you can also be in the passive element of the force length curve, so you wouldn't have a weakness, but you might have decreased ability to generate active forces. So you'd be more stretching than actively contracting the muscle, for example. Now, in the case of the negatives, they have decreased moment arm for the hip abductor muscles, and then the alignment may favor joint dislocation. So I think both of these two abnormalities occur in some childhood diseases, like leg calf Perthes disease and slipped capital femoral epiphysis, and can also be part of acetabular abnormalities. So these are important functional problems associated with the bony anatomy that are relevant to you as clinicians.